And a Cleveland biotech company, meanwhile, says it is making headway on a possible COVID-19 treatment using stem cells. Gil Van Bockelen is the CEO and founder of that company. It's called Athersys. He joins us, as you can see now. Good morning, Gil.
Good morning, Ed. How are you?
Fantastic. Tell me what you're seeing so far that makes you hopeful.
So we recently completed a study that was a double-blind randomized placebo-controlled trial that was evaluating our treatment, Multistem, on patients that had severe ARDS. And ARDS is the thing that COVID-19 is inducing in the patients that are becoming seriously and critically ill. Essentially, Acute Respiratory Distress Syndrome, or ARDS for short, is when the lungs become highly inflamed, they fill up with fluid, and that compromises the ability of the lungs and the body to absorb oxygen properly. The only approach we have for actually helping patients when they become that seriously or critically ill is we put them on a ventilator, and we use the ventilator to force oxygen into the lungs in an effort to keep them alive. But what the results of our study showed was that when we administered a single dose of Multistem to patients that were diagnosed with ARDS and placed on a ventilator, that we were able to dramatically reduce mortality, dramatically improve and rapidly improve pulmonary function. Patients were experiencing less time on ventilators. They were getting out of the ICU faster. And as we announced in January, when we did a one-year follow-up, we saw that there was a dramatic improvement in quality of life for those patients that had been treated with Multistem relative to the patients that were receiving best available standard of care but only got placebo.
Okay, so let's break it down because we have a couple of full screens on the studies. First one conducted in America and the United Kingdom. Treatment began within 4 days of the ARDS diagnosis, which you just talked about. And 20 patients were treated with multi-stem cells. 10 patients received a placebo. And as we continue on with this clinical study, participants evaluated through 28 days and the one-year follow-up you just mentioned, lower mortality compared to the placebo, quality of life outcomes better, treatment well tolerated. So you obviously are optimistic about that, but we keep hearing from various medical professionals saying, let's go easy, we've got to be really careful, we don't want to give people false hope. So where's the balance here in what you're seeing and making sure that these studies are going to lead to actually helping people?
Well, the important thing for people to realize is the study we ran was a double-blind randomized placebo-controlled trial, which is the proper way to do a rigorous assessment to determine whether or not a therapy is safe and effective. And based on the results that we saw from the study, the FDA awarded us fast track designation for this program. Now remember, this was months before COVID-19 had actually, the pandemic had started, but it was based on a very rigorous assessment of our data. And I think that gives us and regulators and other institutions that we've engaged with, like BARDA, for example, who reached out to us in January, before there was even a single case of COVID-19 infection in the United States, because they realized there is no effective treatment for patients that have ARDS. COVID-19 is inducing ARDS in a meaningful number of patients, and that's the primary cause of death. That's what causes patients to have to go into the hospital. So I think the reason why a lot of people are excited about what we're doing is we're the only company with a program that has actually gotten fast track designation from the FDA for treating ARDS, and ARDS is a big priority right now.
And so on that fast track that you talk about, what does fast track mean in this context? Does it mean weeks? Does it mean months? What's the context here?
So the whole purpose of fast track designation is it allows things to get accelerated and expedited. So we've been in active discussions with the FDA over the past few weeks about the design and implementation of a large-scale study that will involve several hundred patients that will be focused specifically on COVID-19 patients that are experiencing acute respiratory distress syndrome, or ARDS. And we're actually very hopeful that we're going to be able to get that study up and running very quickly. We're in constant communication with the FDA and with other folks that are looking to support the study, for example, institutions like BARDA or other ways that we might actually support it.
Last question then, hydrochloroquine and chloroquine, the Z-Paks we've heard about, those are other treatments, separate obviously, but related in the sense that there are a whole bunch of things being fast-tracked, being looked at. Add that to the discussion as well as a final point in terms of the people are concerned and they're hearing about all these potentials. What's your message to the American people about what we might see ahead?
So my message is that there's a lot of people focused clinically on trying to figure out what's the best way to approach this before patients become seriously and critically ill and have to be placed on a ventilator. But I think, as Dr. Fauci said yesterday during the daily briefing, the right way to actually evaluate whether or not something is truly safe and effective is to run properly designed, properly conducted clinical trials. That's what we're committed to doing. That's exactly what we're in the process of doing. And I think the interesting thing is that we may find that combination of things, early intervention that slows the progression of the disease, and late stage therapies like what we have that can really help turn the tide when patients become critically ill. Maybe those are the best approaches to take at the end of the day.
Okay.
But lots of things are being evaluated, and I think we're trying to do it as expeditiously as possible.
All right. Well, Gil Van Buckelen, obviously a lot of people are rooting for some kind of treatment to help so many people who need it right now. Some American ingenuity, a lot of people working on this, including yourself. We appreciate you coming in to explain it.
Thank you very much.
All right. Sandra?